1019 Kink. My name is Mitch. October is Breast Cancer Awareness Month, and I want to talk to an expert on breast cancer. I want to talk about some of the progress we're making with treatment, what you can do if you have a family member or a friend facing a diagnosis. Her name is Dr. Nora Bucher with KINK.FM Oncology. Good morning, Dr. Bucher.
Good morning, Mitch. Thanks for having me.
Thank you so much for taking the time. I know you're very, very busy. It's Breast Cancer Awareness Month. But really, we all need to be cancer aware every single day of the year. Now, most of us know the importance of early detection when it comes to breast cancer. When should regular mammograms begin?
So there's a lot of conflicting information out there. We tend to follow what the American Society of Breast Surgeons recommends, which is if you're of average risk, start at age 40 and obtain a mammogram every year and really no end date unless we think life expectancy is less than 10 years. Maybe stop then. Those who have higher risk are those who have dense breast tissue or family history or a genetic mutation, and then we may need to start earlier or supplement with MRI.
But of course, even if you have no family history, that does not mean you're in the clear, does it? Regular mammograms are still critically important.
You're right. And the data kind of suggests that 1 in 8 women will develop breast cancer. And so some of it is not familial or hereditary.
My guest is Dr. Nora Bucher with KINK.FM Oncology. Are there any lifestyle changes, Dr. Bucher, any preventative measures we can adopt to reduce the risk of developing breast cancer?
Well, it's all the fun stuff we have to stop. You can't really drink too much alcohol and smoking has a very low risk of developing breast cancer, but there is an association. And also maintaining a healthy weight. And an active lifestyle. Researchers feel that being active about 30 minutes a day for 5 days a week really helps cut down your cancer risk.
Now, October is Breast Cancer Awareness Month, so let's talk about some good news. What are some of the latest advancements in breast cancer research or treatment options that can give hope to patients facing a diagnosis?
Oh, there's so much going on, Mitch. There's been a lot of improvement in hormonal treatments, even in early breast cancer, as well as advanced breast cancer, metastatic breast cancer, improvements in using targeted therapies and immunotherapy, antibodies. We have a lot of different tools in our arsenal, and there's a lot more attention these days in general in cancer care to make it more personalized, to really hone in on the genomics of the tumor and make treatment targeted and personalized for the patient.
Dr. Bucher, I know you're a medical doctor, you're not a therapist, but I'm going to ask this question anyway because a breast cancer diagnosis has hit very close to home for those of us here at KINK. One of our team members' spouses is dealing with a diagnosis. So what advice can you offer to families and friends and coworkers on providing effective emotional support?
I think being there and listening and being, that's a huge support. And now with COVID restrictions sort of easing up, we encourage patients to bring a loved one with them to treatment and even to their appointments if they want, just to kind of show that support. And certainly things like helping with transportation and groceries and meal making, certainly all those things are very helpful. But I think a lot of patients just appreciate their loved ones listening and being with them.
So Dr. Bucher, tell me about any kind of support groups or classes that you offer at KINK.FM Oncology for families and friends.
So we have a big social work department that helps run our support groups, and there are cancer classes as well, and these can be for both patients and their loved ones. We also have our palliative care team. When that's appropriate, they get involved, and they provide a lot of helpful, emotional, supportive resources.
Dr. Bucher, thank you so much for everything you do, and thank you for all the good work from KINK.FM Oncology. I truly appreciate you taking the time.
Thank you so much, Mitch.
And here's your chance to do your part in support of Breast Cancer Awareness Month. Every October, Kink is Pink. You can make your donation right now to the American Cancer Society in the fight against breast cancer. You can do it at KINK.FM. And if you make a donation of $40 or more, we're going to hook you up. We have some really cool, brand new, limited edition pink Kink beanies. Did I sell that well enough? Brand new, limited edition pink beanies. It's a fine-looking beanie. We'd love to send one to you. Hop on KINK.FM to make that donation right now.